The COVID-19 pandemic, caused by the novel coronavirus SARS-CoV-2, emerged in late 2019 and quickly spread worldwide, causing significant disruption to societies, economies, and public health. This article provides a detailed analysis of the COVID-19 pandemic, exploring its origins, global impact, and various aspects related to public health, economy, and society. Origins and spread of COVID-19. COVID-19 is believed to have originated in Wuhan, China, where the first cases were reported in December 2019. The virus belongs to the family of coronaviruses, which are zoonotic, meaning they can transmit between animals and humans. Its rapid transmission through respiratory droplets facilitated its global spread, with cases quickly escalating across countries and continents. Public health impact. The pandemic placed an immense burden on healthcare systems worldwide. Hospitals faced challenges such as shortages of medical supplies, personal protective equipment, PPE, and critical care resources. Governments had to implement stringent measures like lockdowns, social distancing, and mask mandates to curb the spread and ease the strain on healthcare facilities. Global case numbers and mortality rates. As of the last available data in September 2021, the COVID-19 pandemic resulted in millions of confirmed cases and deaths globally. The numbers continued to fluctuate depending on the effectiveness of containment measures and vaccination campaigns in different regions. Vaccination efforts. Vaccines played a crucial role in combating the pandemic. Several vaccines were developed and approved for emergency use, with ongoing research to improve efficacy against emerging variants. However, global vaccine distribution faced challenges, and many countries struggled to secure adequate supplies. Economic consequences. The pandemic led to a severe global economic downturn, affecting industries like tourism, hospitality, and retail. Lockdowns and restrictions on non-essential businesses resulted in job losses and reduced economic activity. Governments introduced stimulus packages to mitigate the impact, but recovery varied among nations. Education and workforce disruptions. School closures and remote learning became the norm in many countries, affecting the education of millions of students. Remote work arrangements became widespread, reshaping the workforce and accelerating the adoption of digital technologies. Mental health and social impact. The pandemic's prolonged uncertainty and isolation took a toll on people's mental health. Feelings of anxiety, depression, and loneliness increased significantly. Social distancing measures also impacted human connections, leading to long-term social changes. Disparities and vulnerable populations. The pandemic highlighted existing social and economic inequalities. Vulnerable populations, such as the elderly, low-income communities, and marginalized groups, faced higher infection rates and limited access to healthcare and resources. Global cooperation and challenges. International cooperation and coordination were critical in addressing the pandemic effectively. Organizations like the World Health Organization, WHO, played a central role in providing guidance and facilitating vaccine distribution. However, geopolitical tensions and vaccine nationalism posed challenges to equitable global distribution. Long-term health effects. Studies have indicated that some individuals experience long-term health complications even after recovery from COVID-19. These effects, often referred to as long COVID, include persistent fatigue, cognitive impairment, and respiratory issues. The COVID-19 pandemic has been one of the most significant global health crises in recent history. Its impact on public health, economy, and society will continue to shape policies and behaviors for years to come. By learning from this experience, we can better prepare for future health emergencies and work together to build a more resilient world.